you are really like to use both hands to perform on the patients, but in the endoscopic ear surgery, you just can use one hand operation. One hand with the holding the endoscope, another is using the different kind of the instrument. So for the complex surgery, a lot of stable operation is required. In that under such circumstances, one-handed operation is difficult. The second limitation is the surgical hemostasis. So when in special cases or the difficult cases, when the bleeding is coming, so you need a lot of patience you have to use different hemostatic technique to stop bleeding. So there's some other limitation. For example, when you use one hand to draining the bone through the ear canal, the bone draining work is required during the surgery. So the original mode is inefficient, and you may use curette. You may use intermittent draining with flushing. That's really time consuming and laborious. So the last possible limitation is the thermal damage problem. So all these limitations so restrict you use the conventional endoscopic ear surgery. So in my opinion, one-handed operation and the intermittent hemostasis are the most criticized shortcomings. So there's some factors that limit the efficiency of the endoscopic ear surgery. The incision bleeding. So when the patient starts your endoscopic ear surgery, the first threshold which you need to break through in the learning curve, that's the incision bleeding. So you have to use a different technique to start bleeding. Second one is one-handed operation. So what I mentioned earlier, the extensive bleeding, when the extensive bleeding from the surgical cavity, so a lot of patients require to start bleeding. So here's some changes needed. The first one, the need to patient safety. So when you are doing the operation, the first priority we have to think about is patient safety. The second one, the need to good surgical experience for the surgeon. The third one, the need for the promotion of the endoscopic ear techniques and the training standardization. The last one is the need for the innovation. So after we have to think about how to improve our technique and improve the breakthrough the limitation, the first we can think about or we are doing is the application of a continuous irrigating mode in the endoscopic ear surgery. Maybe some other doctor from different country call it underwater technique. Doesn't matter. We'll show you in one videos. So this is a tympanic superdosis. So we just use the normal instrument to make the ear canal incision. When the incision is completed, we push the flap downward. You see, we don't need to stop the operation procedure to stop bleeding. When we break through the fibrous suckers, we come into the tympanic cavity. you will see a lot of sclerosis disease right there. This is called tympany. Of course, there's a lot of bleeding coming from the surgical field, but a certain pressure of the one-way flushing water while flew the bleeding away or other tiny tissue out of the ear canal. So in that way, you can maintain a really clear and clean surgical view. So right here, you can see a lot of sclerosis disease come into your view. Here's the Matter's handle. And you peel away the residual tamponic membrane away from the Matter's handle. So right here, we start to remove the sclerosis. We curate out some bone from the scutum. Here you go. You can see the joint and the incus and stapes is broken. So we remove the residual incus. So during the operation, we don't have to remove the endoscopy and to stop the bleeding. We just keep the operation continue and continue. So maintain the efficiency. So this is the stepping you see here, quite clear, and it can remain the mobile. So there is a lot of sclerosis right in front of the Matter's handle. We just keep on removing it. So this is the orifice of the eustachian tube. So after remove all the sclerosis disease, we have start to reconstruction. We use cartilage. we elevated the